I was in Chandler. Well, first let me introduce myself.
Please.
My name's John Rittenberg. I'm the Certified AED Specialist for Cardiac Science Corporation. We're a worldwide leader in defibrillation technology. We manufacture the PowerHeart AED G3 Plus with CPR Rescue Coach, and also it comes in automatic, semi-automatic, and also a professional model. So what I was explaining to the group here is that sudden cardiac arrest is often mistaken for a heart attack, and it's actually two different events. And looking back at what Katie's doing and what Dr. Barbara is doing and the entire SHARE program, it's educating the public. And education is the key to success. You educate people on how to perform continuous chest compression, which is a great way to can we cut it?
No, they said just leave it roll.
Oh, I can't do that.
Because just to go on, because they're going to cut it. It has to be uploaded as one piece.
Okay. Well, continuous chest compression is pretty much becoming the standard. Breaths, they've proven that through the studies down in Tucson that it takes 7 more times to get back to where you were before when you stopped to give the breaths, and that the average adult person has approximately 7 or 8 minutes of oxygen in their system. But going back, education is important. You want to know where the AED is, and obviously how to perform CPR if the AED isn't accessible because you want to prolong someone's life. Basically, you're perfusing blood and oxygen to the vital organs at 4 minutes without continuous chest compression or some form of CPR. Your brain starts to deteriorate. You're going to have the start of brain damage, and at 6 minutes it's permanent. So doing something rather than standing around is better because something bad is going to happen if you don't do something. But looking back at sudden cardiac arrest versus heart attack, a lot of people think they're one and the same. And what you have to realize is that sudden cardiac arrest is a sudden misfiring of your heart's electrical system. You go unconscious, no signs of circulation, no pulse, you're fighting for your life, you have 6 minutes to live or die. And a heart attack is the plumbing in your heart. And it's funny, I was on a cold call the other day in Chandler, and I was knocking on the, ringing the bell, knocking on the door, and it's like, can we help you? And I was like, yes, I'm John with Cardiac Science. I'm here to visit with the safety director or the environmental health and safety director to talk to them about having a defibrillator at your place of business, because let's look at it. The OSHA has stated that 13% of workplace deaths are attributed to sudden cardiac arrest, and they said, well, we're 20 years old, we don't need any defibrillation. And I said, you know what, sudden cardiac arrest can happen anywhere, anytime, 3-year-old to 20-year-old to 50, 60, 70-year-old. It's just, people don't understand. They think it's a trick question. Is sudden cardiac arrest the same as a heart attack? Oh, it's the same. No, it isn't. So you have to be aware, you have to know the differences, and if you go to someone, and what's your first name?
Susan.
Susan, can I touch you?
Yeah.
Okay.
Oh yeah, I'm sorry.
Hey, Susan, are you okay? God forbid. Susan was unconscious, no signs of circulation, no pulse. Susan, are you okay? You want to shake them, and if they're unresponsive, you want to call 911, you want to go get that AED if you have, and if you don't, you need to start doing continuous chest compression at a rate of 100 compressions a minute. And you want to buddy up, and that's what we're going to learn in CPR Across America, how to buddy up, how to do, is it CPR Across America?
Absolutely.
And we're going to learn how to buddy up, because not everybody can do perfect compressions. Not even the best firefighters can do perfect compressions. So if you do 30, your buddy pops in for 30, then you go back and do 30, and so forth and so on until we get it done and we save that person's life. The quicker we can do these things, the quicker we can access an AED, the quicker we can get to do CPR, the better off that patient has, and it's all about optimizing patient care and giving that person the best chance of survival.
That's awesome. Do you want to stop it there for a minute?
Sure.